we've got lots of challenges. I think that if that fuels your passion, then healthcare is the right place for you. We are going to need massive amounts of project managers in the future. Massive amounts.
Jenny, thank you so much for joining me today to discuss project management in healthcare. You are a nurse practitioner with a wide range of experience, really, in the clinical field. So I appreciate your perspective on this topic, especially when we're guiding project managers who are transitioning into healthcare. So seeing things from your perspective, from the clinical side perspective, that's going to be very valuable. And I would appreciate it if you could take a couple of minutes, just to tell us more about your experience.
Well, thank you so much for having me. I'm very excited to be here and talk with you today. Basically, my experience, I've been in healthcare, I say since I was 9 years old, but officially I've been a nurse, a registered nurse for almost 20 years and a nurse practitioner for 5. I've worked in various units in the hospital. I've worked in clinics. Um, and my longest tenure was in the ER. I was there for about 9 years in various ERs across multiple states. I kind of became, I guess, an unofficial project manager during one of my last roles. But my most recent role was a nurse practitioner in a neurology clinic.
That's awesome. That's wide perspective from the clinical side. That's very much what's going to bring great value to the discussion today. And we're talking about project management, right? So projects, what defines projects is really change, right? So whenever we're running a project, it's change. What do you think from your perspective, your experience is what makes healthcare so unique when handling change?
There's so much that makes healthcare unique. It's a 24/7 environment, usually, depending on where your projects are. So it's busy, it's bustling, you've got a lot of people involved. And of course, in healthcare, we're people first. So you've got to consider not only the benefit to whomever the project's going to benefit, but everybody that's working on it. And they all have additional responsibilities on top, well, before your project came in, usually. So I it's that is a complication, being able to get the trust of the people that you work for or work with, and get their buy-in and get on common language. All of these are going to be super important. Um, there's so many barriers in healthcare, but healthcare's got its own challenges. We've got legislation that changes all the time. We've got regulatory rules, and evidence-based practice is constantly changing. You know, we've got lots of challenges, but I think that if that fuels your passion, then healthcare is the right place for you. You will not be bored. And I see, in the future, we are going to need massive amounts of project managers in the future, massive amounts.
Have you seen the different units could handle change differently, or, the complexity of managing change, or acceptance of change? Is it different from different units?
Oh, absolutely. I think and I don't necessarily know that it's going to be, unit like, I don't think you could say every cardiac unit across the country, but you have your different mix of people in every unit. You have your different personalities, you have your different leadership, who's on board. I think that could be a benefit or a struggle depending on where you're going. I would think with ER, they're used to rapid change, but I have been an ER nurse, and I cannot say that change is any easier for an ER nurse than it is for any other group. It's really going to depend on your group dynamic, your trust, have you got a clean scope of practice, those sorts of things.
So, Jenny, from my experience, building a trust and proper communication with the clinical team is essential for the success of any initiative. What has been your experience on that topic, or what's your perspective on that from the clinical side?
Yes, that is one of the most important things that you can do, is build that trust and that rapport. If you're able to get in there and meet the team, excellent. Get feedback, hear their voices, involve them often, early. There's so much that goes into these projects that you really want to make sure that you're not going to have to rework because you're not getting the right information up front. So building that rapport is essential so that people feel safe to come speak with you, that you're going to listen to them, that you're going to take their things into consideration. We love rationales in healthcare. I want to know why for everything. I am innately curious, and I beg any new project management professional in healthcare to stay curious. You can learn so much.
What do you think makes it sometimes harder to communicate with the clinical team, and that the project manager needs to take extra steps to make sure that proper communication happens, or properly building that trust?
Sure. Lots of communication challenges in healthcare. There's lots of ways to communicate, which is great. There's lots of technology out there that gives you multiple avenues of communication. The problem is, your clinical staff, they're involved in other things all through the day. So, unless you have a specific, like, hey, we're going to meet for 15 minutes every Monday and just go through and see how it's going, unless you have that time built in, it can be a real struggle for folks. What are the risks? What are the stakes? That's important, because if you can touch our hearts and say the stakes are that you're going to save lives, that right there, that's pretty much a buy-in. As long as it's not, negatively affecting other things, I think, no problem. That should be a buy-in for a healthcare worker. It's going to save lives. It's going to improve health.
One thing which I had to learn, if you want, in healthcare, which should sound pretty obvious, it's hospitals operate 24/7, and you have staff rotating across, around the hour and over weekends. You could go to a huddle and talk to a group of people on Monday, and then you go on Thursday, there is a completely different group. So you have to understand that, if you put a note or you send a note or you talk to somebody, it doesn't mean you contacted everyone, right? So from your perspective, how have you seen that, just from the clinician side, or when you were in the change management as well, organizational improvement?
Well, there was a project that I worked on with a group, and we just were piloting on a specific unit, but we realized that too, that is an issue. You don't have the same group of people working every day or every shift even. They might work a day shift one time and a night shift the other time, but you want to catch, look at how many people work on the unit, catch, X percent that you decide that you want to catch to talk to get their voice, and try to go that way. That's what we had to do, because it was like, we could go every other day, but we've already gotten 4 out of 6 voices earlier in the week. So I think that is a consideration with the time thing, and also implementation of projects, because you can't just do an EHR update in the middle of the night and it doesn't affect anybody. It affects the whole system. I mean, they're going on paper, they're losing their minds. It's, that's not really true. They don't lose their minds, but maybe some.
Just from your thoughts from the clinical side, if we're rolling out new technology, AI, or a system that has an AI component in it, any thoughts, from your experience and from what you're hearing around, what could maximize the success of that as well, or, build more buy-in?
Lots of demonstration, prove that it works. Approaching the team with any demos that you can provide, any data that can back things up, and making sure that there's always someone that's monitoring things, that's checking to make sure that that's correct. I did a dashboard build with a vendor, and that was one of the things that was part of my job. I had to just constantly check and make sure that what their analytics were showing is really the truth. And I had to go in and do all this auditing. So that's super important to get it right on the front end.
So Jenny, any final thoughts? We're coming to the end of this discussion. Any final thoughts you have in mind? Again, we're trying to share the perspective of the clinical team with project managers who are new into healthcare, or wanting to jump into the healthcare industry, which is an amazing field to be in. Any final thoughts you would want to share with them?
Yeah, I would just say to, maintain those relationships, to stay open to communication, to make people feel safe to talk to you, keep people appraised of how things are going, keep a time slot, keep something on the books that's on a regular time. That's worked very well in the past projects I've worked on, making sure that, okay, we have a standing meeting. It might not be long, but it's every week at this day at this time and stick with it. Healthcare is a fun and challenging place to be. But if project management is your jam and you like complexity and people and care, then it's definitely a great place to be.
Awesome. This was so insightful, Jenny. I really appreciate all what you gave us today as advice and thoughts. And it was a pleasure talking to you.
Thank you, Robbie. See you later.